Hello, everybody. Hope you're doing well and keeping safe. Welcome to the 6th episode in our Apollo educational series. My name is Arash Tagvai. I am one of the patient care specialists and medical graduates that works at Apollo. Today's topic is a big one, so I'm going to go through a lot of material. I want to mention now, before I get into it, if you guys have any questions about today's presentations in the past, or anything in general related to medical cannabis, please send them to us. We've been receiving a lot and we're very thankful for the support. Send them to marketing@apolloresearch.ca, and that'll ensure that they come to us and we can address them as often as possible. So again, thank you for that. I'm gonna share my screen with you guys and then we can get started. So as mentioned, today is episode 6. We're gonna be covering irritable bowel syndrome, and then more specifically, we're gonna get into Crohn's and ulcerative colitis. These are conditions that we see in clinic all the time. I'm going to show you where cannabis-based medications can potentially play a role. First, who is Apollo? Apollo was a research institution that began in 2013 that started to take on patients in 2014. That is still where our foundation and where our roots are. We believe in the research. We want to learn as we go, and we consistently are updating our treatment plans for our patients based on what we observe and what we see. Currently, we are open as an essential service and available to patients from coast to coast. We've also gotten a few inquiries recently about patients who are worried about not being referred from their family doctor. Guys, I want to make it very clear. We do not require referrals to be seen at Apollo anymore. We do welcome walk-ins. Of course, if a referral is present, we're very happy to oblige. The more minds involved in any patient's care, the better, is the way we see it. Diving right into it, guys, CBD. This is a chemical compound that is removed from the cannabis plant that we take advantage of as a medication. It has many different receptors in our body, and I'll go through them. But what's most important to remember about CBD is that it has no real psychoactive effect. It can be used safely, and it can be used openly, and in a lot of ways for a lot of different conditions. The second chemical compound that we take advantage of from the cannabis plant is called THC. Now, a lot of times when we say THC in clinic, there's a bit of a stigma towards it. There's a bit of a fear towards it. Guys, remember, THC and CBD in the peripheral nervous system have a very similar role. They help with pain, they have anti-inflammatory properties, and in this particular episode, we're going to cover their immune modulating properties and what that really means. Do not think that if you're using THC for medical purposes, you are using recreational cannabis. There's a big difference in dosage when it comes to recreational versus medical, and these are things that we discuss with patients on a daily basis. Knowledge is power. Education is required, and we know that, and we help people through it. This is a breakdown of the endocannabinoid system and a further discussion of cannabinoids in general. Cannabinoids are a class of compounds and receptors in our body. There are several different types. There are synthetic compounds known as nabilone or Sativex that are available. There are endocannabinoids, the word endo meaning Latin for inner cannabinoids. Our body produces two substances known as 2-AG and anandamide that are very similar to CBD and THC in action in our bodies. And then we have phytocannabinoids, and those are the ones that come from the cannabis plant, and those are the ones that we're able to take advantage of as a medication. So again, we're very, very happy with a lot of the results we see in clinic, and the reason we have these great results is because of this system. This is a further breakdown of the endocannabinoid system and where these receptors exist. So keeping in mind that cannabis has a wide variety of demographics and conditions that it can help with, this is one of the key explanations to that reason. So the large intestine, the small intestine, the stomach, all have receptors for both CBD and THC. The only real section that's left off here in the GI tract on this slide would be the mouth, which is where the digestion for all carbohydrates begins. But we are discussing autoimmune conditions today that mostly take place in the large and small intestine. Again, we'll get to them here in a second. In the past, we had done an entire segment dedicated to mental health. And I mentioned then, and I'll mention it again, approximately 50% of Canadians are reporting that there has been an effect on their mental health since the beginning of the pandemic. This is a serious issue. This is something that we address with our patients consistently. And this is something that also ties into the topic today that we have at hand. So I wanted to just take a brief moment to discuss it. A lot of times in clinic, patients will tell us, well, I am having some anxiety, and that is making my digestive system react differently. The same foods I used to consume, I'm having trouble with now. Or altogether, they'll say that I am now having a flare in my condition based on the way I'm feeling mentally. Guys, we firmly understand how anxiety can affect the gut, but it's not always explained by physicians, again, because they're busy. I'm not trying to throw shadow or shade at anybody, but this is a brief explanation of how mental health affects gut health. So if we look here, it's a simple cause and effect. Serotonin receptors are in our minds and in many other places in our body. Serotonin is a neurotransmitter that is created in our brains, and decreased or increased levels can cause an increase or decrease in emotions. Anxiety is something that occurs and can cause a decrease or increase in serotonin as well. There are more receptors for serotonin in our gut than there are in our brains. So clearly, if someone is feeling anxious for a long period of time, it's going to have effects on the stomach. And in fact, it doesn't need to really necessarily be for a long period of time. Patients report to us that they were scared of something going on in one day, or they had a job interview that they were really nervous about, and they were sick for several weeks afterwards with their GI symptoms. This is something that we hear, guys. Anxiety puts people into a fight or flight situation as well. It causes a sympathetic tone. And one of the systems that turns down or basically shuts off during sympathetic tone is the gut, is the GI system. So if we understand that neurotransmitters, stress and anxiety, and sympathetic tone can affect gut health, this is something that we must address. A lot of times patients will tell us, when I use high levels of CBD, I'm able to control my pain and control my flares. But anxiety requires a small dose of THC as well. Usually in the evenings, I'll take a 2.5 milligram, I'll sleep better, I'll wake up feeling better, and for that reason, my gut health is better as well. Again, I just want to take a quick moment to go over that with you guys, and it's something that we see in clinic often. It's something I wanted to address. CBD and THC have a lot of other therapeutic effects, and this list is something that we've just put together that we see in clinic often. Top of the list, chronic pain. Okay, we're helping a lot of people get through their day and improve their quality of life by handling their chronic pain. If we go down this list, there is irritable bowel syndrome. We can see ulcerative colitis, and after migraines, it's Crohn's disease. So today, the specific conditions I'm going to focus on are ulcerative colitis and Crohn's, as mentioned, and then the irritable bowel syndrome. So let's first get into the difference between Crohn's disease and ulcerative colitis. So I'm going to start with Crohn's, right? And this is a condition. Both of these conditions are autoimmune. Let me start with that. That means the immune system is attacking either the mucosal surface or the entire GI lining. With Crohn's disease, it is considered a transmural attack. That term means all layers of involvement. They do have pretty severe reactions to certain foods, to certain moods, or sometimes it's unexplained, it's environmental, and they don't understand exactly why it happened, but it happens. The cells involved, and again, I don't want to get too technical, guys, are T cells and macrophages. These are your body's secondary response in your immune system. Initially, a cell goes in there and says, well, this doesn't look like it needs to be here. These cells look foreign. This looks like an infection. I'm going to send off a bunch of signals, and the T cells and the macrophages will show up. They'll kind of enclose that bacteria and try to get rid of it in our bodies. They digest that guy. So when that process is turned on without a bacterial infection, it's an autoimmune condition, and now the GI lining is left exposed to our immune system, which can be quite aggressive. With Crohn's disease, there are skip lesions involved. What that means is that there are lesions all over the immune tract. They can start in the small intestine, they can be in the large intestine, they can go quite low, they can come quite high, but that means that there's a lot of sparing of the GI tract. And generally, it's mostly pain. There can be some blood in the stool, and there can be other symptoms involved, but malnutrition is rare in Crohn's disease and happens much, much later in the condition because of those skip lesions, because they're all over the place and they spare a lot of the colon. Now, that being said, the condition is still very serious. Cannabis is known to help with inflammation. Once these attacks occur, there's a lot of inflammation in the body. And inflammation never stays on one place. It does travel. And if inflammation becomes systemic, well, then we have other conditions that can flare as well. For example, I have degenerative disc disease and Crohn's disease. When my Crohn's is bad, my back tends to hurt more. Or I have degenerative disc disease in my neck, or I have neuropathic pain in my feet. There are many conditions that can flare with systemic inflammation. Cannabis plays a role with ulcerative colitis in reduction of inflammation post-flare, and also cannabis has immune modulating properties. What does that mean? An immune modulator means that it can help the immune system come back towards homeostasis, guys. Back to equilibrium, back to balance, back to where it should be. As opposed to it flaring and being here, cannabis can bring it down. That being said, the treatment options for Crohn's disease are steroids, prednisone to turn the immune system down, or antibiotics that are known as sulfasalazine or the sulfa family. They have anti-inflammatory properties to them, and generally patients who are going through bouts of Crohn's disease respond well to these antibiotics. Now, prednisone is a medication that no patient needs to be on for any extended period of time. Any doctor who puts a patient on prednisone is doing it out of their last resort. The patient is in a lot of pain, they can't control the flare, so they give them a short course of prednisone, and fingers crossed that the condition reduces in severity and they're able to move forward and potentially watch out for certain trigger foods or trigger situations, and again, hoping that it doesn't come back. CBD also has immune modulating properties. Prednisone can make someone immune compromised and also affect the kidneys. CBD does not have the same side effect profile, yet it can have very similar results when used as immune modulators. So this is a very important thing for patients to understand when it comes to Crohn's disease. We can help with the amount of flares that occur, and we can also help with the post-inflammation that comes from a flare. These patients, once educated, must receive a very aggressive treatment plan. Again, safety is our priority. They will be educated. They will be told what's correct and what to watch for. But once they understand the modalities of the medication, we want them going up quickly. We want the dose high so we can potentially control these flares and help them feel better. Patients will report to us that I used to have a flare twice a month with my Crohn's disease, and now I get 3 a year. CBD has changed my life. I'm very thankful for it. We'll hear that often. Again, these are conditions that respond well to cannabis. Crohn's disease is T cells and macrophages. Ulcerative colitis works with interleukins. And guys, I don't want to get too detailed. I don't want to sound too boring. But ulcerative colitis is a condition that does not have skip lesions. It can start in one area and it'll continue to creep forward on the mucosal surface only up the digestive tract. This is a very serious condition. Sometimes these flares will lead to large sections of the bowel being left with loss of function. If the mucosal surface on your gut is completely worn out, then that part of the gut lining does not have the ability to absorb anything that is consumed, and in fact, it will turn into scar tissue if the attack of the flare is bad enough. What does that mean? Once scar tissue is formed in the digestive tract, the digestive system in that area will lose mobility and become stiff and hard. Sometimes on an image, whether it be an X-ray or another type of imaging, that will look like a solid lead pipe in the patient's gut. And it gained that term, a lead pipe colon appearance. Ulcerative colitis is also one of the conditions that increases risk of cancer. This is a very, very serious condition that comes with a ton of systemic inflammation when flares do occur. Guys, I want to make it very clear. Both conditions are very serious, but ulcerative colitis is more linked to medical oncology than Crohn's disease at the time, from what we understand. So when it comes to cannabis-based medications and ulcerative colitis, we want to ensure that patients are using consistently, again at the correct dose, to potentially control all inflammation and work as well as immune modulator, guys. Autoimmune conditions respond well to cannabis once the correct dose is found. Our challenge is the dose. The results will follow. And a lot of times we have to explain that to patients in clinic, so I'm happy to share that with you guys now. I've discussed the more specific conditions that I wanted to go over. Sometimes a patient will go to a doctor and say, hey doc, I don't feel so great. Last week I had some spicy food, but it's been 4 days since and I'm still feeling the same. The doctor thinks, okay, well, this may be ulcerative colitis or Crohn's. Let's go ahead and see if I can diagnose this person. Initially, they will do a full CBC, a blood test, to see if there are inflammation markers, and if there are there more specific antibodies towards these conditions? So are there T cells and macrophages? Are there interleukins? Are there inflammation markers? These are all things that he's looking at when he sees the lab results for these conditions. Now, let's say he takes these lab results and they're negative. It doesn't show any kind of immune assay. It doesn't also show any kind of inflammation that is standing out. There is inflammation, but it's not at a high enough level. The ESR count is too low. That means the inflammation is not as high as we would think it would be for this condition, so it's considered a negative test. The physician may come back to the patient and say, well, it's not this and it's not that, and so we will call it irritable bowel syndrome, which is a generalized term and a diagnosis of exclusion. If they can't find out exactly what it is, they have to give it a generalized term. And again, that just comes from them being unable to find out exactly what the cause is. So we are now venturing into irritable bowel syndrome. So what we understand is that these are diagnoses of exclusion, like explained. The only difference between a disease and a syndrome is the involvement of systems. What does that mean? If I have constant stomach pain, that's considered irritable bowel disease. If I have constant stomach pain that is causing me to lose many, many nights of sleep and is now affecting my psychiatric health or my neurological health, I've now crossed over from one system, the GI tract, into the second system, which is neurological system, the brain, and now that becomes considered a syndrome because there are two systems involved, not just one. That is the main difference between a disease and a syndrome. And so patients are diagnosed with irritable bowel syndrome, which is a diagnosis of exclusion. And that's, again, a question that we have often in clinic, and I just wanted to take the time to express and explain to you guys the main difference. Other times, a patient will have multiple system involvement that is involved with an autoimmune condition. A great example would be asthma. When I have a very, very upset stomach due to my irritable bowel syndrome, my asthma acts up. The patient is educating somebody and they don't even know it yet. They don't even know that they have explained the difference between a syndrome and a disease. But again, that's something that we discuss often in clinic. Guys, remember, CBD has a role as an anti-inflammatory and CBD plays a role as an immune modulator. THC does the same. The correct dosage of THC is something that we monitor closely, and patients do attain a lot of benefit from the use of THC and CBD in congruence. It becomes something that is known as synergy, right? We double up the process when we use both CBD and THC. Now, knowing that CBD can help with alleviation of symptoms and potentially aid with disease progression, what we want to know is some of the other stuff that we can do to help these patients out or help these conditions out. Patients ask us all the time, what's this whole thing about probiotics? Should I be taking this? What's this whole thing about kombucha? What's the stuff everyone's drinking? Guys, remember, these are things that have been in market for a long time now. Sometimes patients have a better or worse response to them, but we really have to give them an honest understanding. Kombucha is a fermented drink that is designed to help with gut flora. The term gut flora refers to the healthy bacteria, the required bacteria that live in our guts. A healthy balance of good bacteria helps us with protein digestion, all food breakdown, and the reabsorption of some of our digestive enzymes. So we're not just wasting them. When those bacteria eat up some of the food that we put into it and they die, our bodies reabsorb what they have. It is really a life cycle within our bodies that no one really even pays attention to. Kombucha can further strengthen those colonies of bacteria that live in our guts and help with digestion in general. Again, a fermented drink will have high levels of acid in it. When we drink high levels of acid, it assists our stomach with the further breakdown of our foods. The second one on this list is probiotics. Probiotics are the actual bacteria that live in our guts. As mentioned earlier, in Crohn's disease, sometimes people are on long-term antibiotics to help with their condition. Sulfasalazine has had great results, and the dosage vary from 500 to 3,000 milligrams depending on the severity of their condition. So if a patient is on the upper echelon of dosage and they're taking anywhere from 2,000 to 3,000 milligrams a day of an antibiotic, you better believe that that antibiotic is going to cross over and start affecting some of the natural required bacteria in their gut. Probiotics helps repopulate these bacteria. They can help with gut health balance. And again, guys, these are things that we discuss in clinic all the time, and I just wanted to take the time to discuss them with you as well. The side effect of taking too much probiotics or too much kombucha can be generalized bloating or flatulence. And again, these are things that we counsel our patients on. This is important to know and important to understand. Our health is something that is, again, a value to us as an individual. We will ask for the aid of a physician or other healthcare professionals, but in the end of the day, it's up to the individual to make those decisions. And all of these things here that we're discussing help with an overall approach to gut health, not just the conditions. But CBD is one step closer to ensuring good gut health. And these things here that I've mentioned, again, are discussions that we have in clinic often. All right, guys, I think I'm going to get into the questions here. Let me just double check and make sure. Oh, one last piece. I wanted to talk about our Apollo process. Guys, this is something that we get asked about often, but I wanted to just briefly go over it, and then I'm going to take as many questions as I can. First and foremost, a triage is completed for every patient who comes into the Apollo system. This is your past medical history, your current medical diagnosis, the reason you're looking to use medical cannabis, current medications. These are things that the doctor must evaluate. After he has all of this information, and that might even include imaging, we go into the consultation piece. This is where the doctor has access to all your medical records and can discuss with you how he would like to formulate a treatment plan best suited for you, the individual. After the consultation, a medical document is generated, which is a prescription, and after that, there's a full education to follow. The education is where you will have all of your questions answered. It's always tempting for a patient to say, well, what about this, this, and this, and this to their doctor? And the doctor says, I understand that you have these questions, and our educators are very well armed with that knowledge to answer them for you. And in fact, we have a connection with our educators on a routinely daily basis. So they work very closely with the doctors. After the education, a registration is required because as of now, as I'm standing here or sitting here recording this video for you guys, medical cannabis is only available from online pharmacies. So after you've been registered, you will have your medication sent directly to your door. So that's what I've presented, and that's what I've prepared for the presentation. And today I'm going to go into the questions, guys. And again, I'm going to take a few from the ones you've sent in. Thank you so much for sending them, and we really appreciate the continued support. First question. Why and how does cannabis work for IBS? Okay, so as mentioned prior in this video, irritable bowel syndrome is a diagnosis of exclusion that involves more than one system, more than just your gut, two systems. There is systemic inflammation, CBD can help with that. There is also immune modulating properties that cannabis can help with as well. Reduced number of flares, reduced days required to recover. Those are the two major points that you must take away from this video, if nothing else. Good question. Second question. Is it better to take it every day or just when I flare up? Or if I anticipate a flare up? Is it better to take it once per day or multiple times per day? Okay, so we've got two questions here. First and foremost, to attain the true anti-inflammatory properties of medical cannabis, it does need to be used continuously. We're looking at 3 to 4 weeks of consistent use for anti-inflammatory properties to really take effect. Now, if you're using cannabis or medical cannabis from a Tylenol or Advil standpoint, where you take it when you have pain or you take it when you've injured yourself, that's okay. It still helps a lot of people. But if we're diagnosed with a specific condition that is inflammatory, it's best to use it more regularly. The second question, should I use it multiple times per day or once per day? That'll depend on the individual's metabolism. Sometimes patients tell us, I take a large dose first thing in the morning and it helps me with my knee pain and my back pain or my headache throughout the entire day. Other people tell me that doesn't work for me. When I take a dose in the morning, halfway through my day, my pain kind of comes back. Well, guess what? That means that your body's metabolism moves a little faster and it's already gone through that medication and the effects have worn off, well, then we need to add a second dose. Generally, we find in clinic anywhere between 6 to 8 hours apart is where we like to have our doses. Some patients take a smaller dose several times throughout the day. Other people take a large dose once a day. Again, it really depends on the individual, and that's something that we love to address with our patients. And we say, Mr. and Mrs. Smith, how are things going? And they say to us, well, things are great. I'm able to put away a bunch of my other medications, but every day at 3 o'clock, my knee is bothering me again. Well, tells me that you need to take a second dose at 1 o'clock. Remembering that first pass metabolism is required for all ingested cannabis, it takes about an hour and a half to 2 hours to kick in. So if the pain shows up at 3 o'clock, I'm going to add a second dose at 1 o'clock just to make sure we're covered. Great question. Thanks for sending. Okay, the next question. How much is enough? I've been taking 0.6 ml of CBD twice a day for quite some time. It seems okay, but sometimes when things get worse, I would like to take more. Is there an advantage to using more CBD? Would vaping in the moment also help with my symptoms? These are excellent multi-pronged questions that I really like to see. What is best in terms of combination, CBD alone or CBD and THC? Okay, so a very loaded question, guys. I'm going to take it one part at a time. This person's dose is 0.6 ml twice a day. That is a very great dose, and there's nothing wrong with that dose, and you're actually quite far from the max. But in this particular case, I would want to have an increase in one dose at a time. I would take the morning dose, the first 0.6, and take it to 0.8 and potentially 1 full mil, and leave the afternoon dose at 0.6, follow up in a week. See how you do. If the pain is still not being addressed, well, then we leave the 0.1 and then we increase the second dose. If that helps, great. If not, we will add the third dose, and that'll be 4 to 6 hours after the afternoon dose. And again, we will start low and go slow to ensure patient safety. Generally, if we've exhausted that option and we're at 3 times a day and we're still not reaping benefits, well, then we have to try another strain. And we say in clinic, we must try a minimum of 3 strains of CBD before we can say that CBD has not played a role in this patient's particular case. It's a very low percentage of time where we have to shake hands with our patient and say, we tried our best, we apologize. Well, we're not really apologetic, but we tried our best, and this particular medication is not going to work for your condition. It's a very rare event, guys, because generally when we change strains or find the right dose, we're able to help those patients out. So really, really good detailed question about how we would dose patients who are not really reaching the maximum benefit that they could. The next portion is, will vaping help? Now, when the medication is inhaled, it is a lot faster acting. It kicks in about 5 to 10 minutes. I've discussed this on previous videos. And then it leaves our system in about an hour and a half to 2 hours. So yes, it can help for breakthrough pain. Yes, it can help for panic or PTSD or anxiety itself. All these things can be addressed with inhaled forms of medical cannabis. Now, long term, I would want to adjust your ingested dose further before saying vaping is the way we're going to move forward. There are a tremendous number of people that benefit exponentially from vaping cannabis for their condition. It may not be best for everybody, but I know it helps. And I know it helps a lot of people. So another really, really good question within the question. And the third layer of this question, what is the best combination, CBD or THC? Guys, they both play the same role in the peripheral nervous system. The roles are slightly different in the central nervous system, but to ensure patient safety, we always recommend very high levels of CBD with the introduction of THC slowly. We would come in at something under 5% THC and ensure that the patient is in a safe environment to try this medication. And if they tell us it was phenomenal and I got a whole bunch of reading done and I was able to function, well, then guess what? We may have found a strain that works well for that patient. Other times a patient will try CBD and they say, this is great and this is where I want to stay. And that's okay. Again, with the education that we provide our patients, no one has ever felt unsafe with our process, with our personalized treatment plans. Really detailed question. Great one, guys. Okay, the next one. Are there any reasons why I shouldn't use cannabis for IBS? Well, here's the thing. No, Anybody who has a diagnosis of irritable bowel syndrome or irritable bowel disease will benefit from the use of cannabis-based medications, but we have to ensure that it is the correct approach. And what do I mean by that? If someone has irritable bowel syndrome and they go to a local source store who is trying to help people, there is nothing that they are doing that is malicious. They're trying to help people, but they don't have a laboratory tested product, and they give this product to somebody, and that patient uses that product, and they have the opposite effects. Instead of calming and alleviating the flare, things worsen. Then potentially cannabis is looked at as harmful for that patient, but that's only because we don't know what he used. I don't know the composition and the makeup of the THC and CBD, and I also don't know where that strain came from. There's a lot of insecticide and pesticide use when it comes to the growing of cannabis that is not regulated by Health Canada. Non-licensed producer cannabis can have a wide range of chemicals in it. And again, this can cause a reaction in some people, and other people say, well, I've been using it for this many years and I'm okay with it. We respect that. But if a patient has a diagnosed condition and they're looking to have cannabis-based medication as a treatment option, I would want it to be controlled. I would want it to be regulated, and I would want it to come from a source that is firmly tested by Health Canada and regularly tested by Health Canada. So the only time I would say you shouldn't use cannabis-based medications to address irritable bowel syndrome or disease is if it's coming from an unregulated source. Other than that, there's no reason to hold back. There is no reason to hold back, guys. Another very good question. What can I do besides using cannabis to help with positive impact of my gut health? So there's a whole bunch of things in this video that we have discussed, guys, but if we're using CBD, if we're getting into digestive aids such as kombucha, or getting into bacterial counts with probiotics, the third or the fourth or the fifth thing on that list is going to be lifestyle, diet modifications, and really just listening to your body. Gone are the days of thinking that our gut is just a pipe that I throw food into and it does its job and I don't have to worry about it. Our gut health is so important to people these days and so important to the individual because we understand the benefit that we can have if we are doing well. And no one wants to have an upset stomach as they're going through their day and just kind of have to fight through it. We have to start understanding on a very granular level what's affecting us. There are certain people who can eat anything they want and they're okay. And there are other people who will have a 4-day reaction to just one type of food. For example, dairy, right? They never knew they were lactose intolerant. In fact, they're not considered lactose intolerant, but they still have a poor reaction. Their gut health is imbalanced when they have a lot of dairy in their diet. Again, these are things that we see and these are things that we hear. So lifestyle modifications, diet modifications, and an overall understanding of what affects you would be the best approach. All right, guys. I'm going to take one more off of the list. And again, this was a very, very interesting question. What medications could this potentially replace for someone suffering from GI issues? Okay, guys, so remember, the main medication that is used for most autoimmune conditions, not all, but most, will be immune modulators. And in this particular case, we're talking about prednisone. You'll have a short course of prednisone from your family doctor, and cannabis could potentially help reduce that. The second medication that is being used for Crohn's disease is called sulfasalazine, which is an antibiotic that has anti-inflammatory properties. About a fifth of all prescriptions in modern medicine are off-label. So this medication came out as an antibiotic, but they found out people with Crohn's disease that were using it were doing better. So they started using it off-label. And now it is considered one of the treatment options for Crohn's disease. So sulfasalazine and prednisone would be the two medications we would address with the topics of today, the ulcerative colitis and the Crohn's. So those are the medications that we could replace with cannabis-based medications. All right, guys, that wraps it up. I've left our phone number and our website. I urge all who are interested to reach out to us. If nothing else comes from it, a bit of an education will occur. And a lot of our patients are very thankful for us and having our level of education at such a high level. Please remember that an assessment for patient safety is our priority and education is a priority. All results are an observation after that. And again, we want to ensure that our patients understand that. Thank you so much for sending in your questions. Again, I hope everyone is enjoying a safe and fun summer, and we'll be back again next month with episode 7. We haven't decided the topic yet, so if you have any suggestions, send them to us, marketing@apolloresearch.ca. Until then, take care, stay safe, and see you soon.